We then took that information to narrow the sources, again, thousands of bits of data extracted from records and schedules to identify who were the people involved where these patients have crossed our care system. These patients were separated by many months in their care at Mayo, so we knew we had to cover great periods of time. That led, as Bill said, to the identification of interventional radiology as the most probable place, and with the subsequent testing of the individual, we were able to locate what we believe was the missing piece of information. This employee has the same strain of hepatitis C as the 3 of our affected patients.
So what are we doing about it? This individual managed to circumvent our processes for control of these narcotics. He stole them from us and from the patient and got through our very tight systems. That's leading us to step back and relook again at the multiple systems we have in place to control narcotics and find even tighter ways to do that. More important, we're working with the Department of Health and the Centers for Disease Control to go back and try to figure out if anybody else might be at risk for hepatitis C. And we intend to, in cooperation with the Department of Health and the CDC, to notify those patients as quickly as possible and get them in for testing. If patients are out there and they're concerned, they should call us. We actually have a 1-800 number. It is 1-877-956-1768, or even locally just the 956-1768. We have a hotline to answer people's questions and help with getting that screening arranged.
We've been working this morning to notify all of our staff, our employees, who understandably have been shaken because of their passionate commitment to our primary value. So we've been working throughout the morning to communicate with all of our staff internally.
Our hearts go out to the patients and their families. Our staff is devastated by this broken trust, and we're doing everything in our power to regain that trust through this open sharing of information. We will continue to share it as we have it.
Get back to the primary focus of Mayo Clinic's activities is to provide the highest quality care, the safest possible environment, the best outcomes possible. We believe we're leaders in that area. The whole organization is focused on quality. It's our most important focus, and that's why this is so absolutely devastating to our staff, because it demonstrates, it's a tough reminder that an individual can circumvent all the checks and balances that you put in place if that person has, in this case, drug-seeking behavior. Now, you've asked about drug screening. I'm sure some of you are thinking about surveillance cameras and so on. Perhaps our biggest asset is the trust that our patients have in us and our trust in each other. And what we are working with our staff is to remind the 56,000 Mayo Clinic employees that we trust them, but we need all of them to work together as the eyes and ears of Mayo Clinic to make our patients' situations safer. We have a 24-hour anonymous hotline they can call if they have any concerns, a compliance hotline. We need everyone to work together to make certain that what they see in their daily job does support that we are providing the best care for our patients. That's much better than a surveillance camera or drug screening. Not that we won't do some of those where it's appropriate, but we really need to turn our staff's attention increasingly to this effort, not only to make the patient's outcomes safer, but the environment safer, because there will be bad actors out there. This happens. This is a terrible reminder of what happens in healthcare as it does in other sectors of society. But we wanted you to hear this completely, candidly, as quickly as we knew it.